You're still watching TVC Breakfast. Now, Corporate Accountability and Public Participation Africa, CAPPA, has commended the federal government's plan to channel excess tax revenue from alcohol, tobacco, and sugar-sweetened beverages into health financing. Now, the group described the move as an opportunity for the Tinubu administration to secure sustainable funding for Nigeria's fragile healthcare system and safeguard citizens' health. Chairman of the Presidential Fiscal Policy and Tax Reforms Committee, Taiwo Oyedele, disclosed at the National Dialogue in Abuja that the draft policy is being finalized and will soon be submitted to the Minister of Health and Social Welfare. CAPPA, however, warned that Nigeria continues to face poor health financing and an increasing burden of non-communicable diseases driven by high consumption of sugar, salt, tobacco, and alcohol. Now, joining us via Zoom all the way in Kenya is the Executive Director, Corporate Accountability and Public Participation Africa, Akimbode Oluwafemi. Good morning, sir. How are you doing? Good morning, sir. Can you hear me? Good morning, sir. Can you hear me? Okay, very good. Now we're having this conversation and we're saying that, you know, if this happens, people will not be buying sugary drinks as much as they buy it. We're also speaking about health. You know, we speak about what sugar does to the body, and we speak about the fact that it's easy for people to access it. But if this is brought up, you know, people will not be able to access it as they do. Now the question is, you know, how well do you think this is going to ease people, you know, buying sugary drinks as well? Okay, sir. Yes, I have you. I have you here, sir. Sir, did you get my question?
Yes.
Okay.
Can you hear me now?
Yes, I can hear you.
Okay, so thank you very much. And let's just put this in the context a little bit. The conversation globally around health these days is about innovative health financing, and it's about preventing illnesses even before they happen. And that's more important when we look at our country. This kind of conversation has come up, you know, very strongly in the July meeting about funding development. It came up again in the WHO statement urging governments to increase taxes on the three unhealthy consumption in alcohol, tobacco, and sugar-sweetened beverages. And it also came up in Lord's conference that was held in Abuja. Let me say very clearly that for over 2 years, we've been asking government to look at all those what is easily called sin taxes in order to be able to finance public health in Nigeria. Nigeria currently budgets about national budget for health about 3.5 to 6% in years that we're very lucky. 69% of health financing comes out of pockets. The federal government is responsible for about 12%, state government about 8%. Official development agencies gives us about 3%. It's an abysmal situation that we have. We all agree that the health infrastructure in Nigeria is decaying. And so it's good news for us that finally the Nigerian government is looking at how to use, you know, these taxes to fund health, most importantly to earmark them. Yes, the taxes are meant to reduce consumption so that the less people consume these unhealthy products, the less illnesses that we have in our country. And again, it's a double win because there will also be revenue for health.
Now, accountability is something that we have to take into consideration when we're saying this, because what we're saying is that, okay, we're going to increase taxes on these products, sweetened drinks, tobacco, and so on, and the monies realized from them, which to me is quite creative and very, very good, because you are taking monies accruing from things that are dangerous to the health to finance the health sector. It makes a lot of sense. But how can we be sure that we have these monies actually invested in the health sector in Nigeria? Is there any oversight plan by CAPPA or any other organization?
So number one is why the disclosure by, you know, the chairman of the Presidential Task Committee is so heartwarming, that now there is a policy in place. You know, they are working on a policy which we are backing, that once that is adopted, once you have that instrument, you have the instrument for which to monitor. Then we've also, you know, requested some level of accountability and disclosure. So a 10 naira per liter, so little, it's extremely inadequate, was imposed through the 2021 fiscal budget on SSB tax. Yes, we asked for the increase from 10 naira per liter to something like about 130 naira per liter, which must also be adjustable to inflation. And when we say this, we just want people to get the figures right. As at the time that 10 naira per liter was imposed, the price of your favorite 55 cl soda drink was around 100 naira. That 55 cl, which is like I think 2 or 3 or more of that makes a liter, makes a liter. It basically means we getting less than 1% of what is currently selling for at 400 naira, 500 naira, some even 1,000 naira. So that tax first in itself is grossly inadequate. We've argued that we're not even sure that it is well planned to even pay for the cost of administering the tax itself. You understand what I'm trying to say? That, look, you have a tax that when you look at the administrative procedure to collect the tax, we're not even sure that is even able to offset that cost. So we have argued that that should be increased significantly to bring down consumption. We have also supported that, look, an instrument to earmark be put in place. Once those instruments are in place, we can then continue as CSOs to monitor compliance and, most importantly, to monitor how these funds are then used for health infrastructure, health facility, provision of health. And I'm very happy that even the chairman again mentioned that some of these funds will also be used to address disability issues in this country.
Yeah, it's so good that we're having this conversation, and some people are already kicking. They're saying that why you forcing us not to take sugary drinks is something that works for me. If I want to take it, why are you forcing me not to take it? And why you're taxing it in the first place? And because you're a Yoruba man, I believe that this proverb will resonate with you when you are asking a chicken not to go to the what's it called, the refuse dump, and is fighting, saying that you are not allowing me to forage. So how would you, how do you think this message can be driven to people like that? So much so that they will not see that, okay, there will be job losses and all of that. And then now moving to alternative drinks, like the homemade drinks that are not taxed and other sugary drinks that are not well regulated, because they have to take it. Because if you go to the bus stops, you find some of these drinks, under the name of Tiger Nuts, Zobo, etc. And then they'll be adding more sugar. So they see it as alternative. How do we drive the message to them?
So the first thing that we need to tell ourselves as Nigerians is that we are having an epidemic of non-communicable diseases in Nigeria. In fact, there is an epidemic of he slumped and died. Oh, he was driving and then he suddenly, dozed off, and then before you know it, he died. He died in his sleep. We're having an upsurge of, hypertension, diabetes, cardiovascular diseases, and the rest of them. And so the evidence are just there that NCDs are being driven by these lifestyles and consumption, alcohol, tobacco, SSBs, and of course, physical exercise. And governments around the world are saying, look, the environment that encourage people to engage in these lifestyles needs to be discouraged. WHO had recommended a 50% increase in the price of some of these drinks to bring down consumption. And so the point is, often you see the industry coming up with arguments like, oh, there's going to be job losses. These are, progressive.
Oh, boy.
Yeah, can you? Okay, I think the network there. Okay. Okay. I think the network there. Oh, but with everything, I think we have it.
Go ahead.
Do we have you back, sir? You can go ahead.
What we're saying is that it is also the duty of government to encourage citizens to live healthy lifestyle. Our elementary, studies of taxation, tells us that you use taxation for multiple purposes. As we are actually seeing in global debates now, you can use taxes to even grow your local economy. You can use taxation to to improve on the health of your people. And so this is actually a
Okay.
Okay, the network
All right.
is.
I think the network is
giving us some.
Will encourage Nigerians to spend. Okay.
Carry on.
Carry on, sir. I think your network, but carry on.
Okay. So, what I'm stressing in this is that it's not that it is the government is forcing people, not to consume the product. But the government is removing those environments that are encouraging unhealthy lifestyles.
Okay. Let me put in another question to you, sir.
No?
Yeah,
yes, you are. Can you hear me?
We can hear you.
Great.
I think there's
Very
a delay. Yeah.
Great. Let me bring this question in. You talked about that government uses taxes to, strengthen the economy. Okay, but let's look at this scenario. If we're now beginning to, because this happened with, I think, beer, and we really didn't see a reduction in consumption of beer, except you can give me the statistics to show that. And now we're coming to sugary, drinks, as the case is now. If it is then eventually taxed to the percentage the government is planning to do this, and assuming the consumption reduces, it therefore means the companies that produces these drinks, would obviously run down in production, which reduces their capacity. Will that not at the end of the day affect the economy in general that we're trying to boost up? What do you think?
Thank you very much. That's a very fantastic question. And there are studies around the world, studies in Nigeria. We've also done our own economic study. Does not in any way directly support that easy assumption that corporations want us to believe. It takes time. It takes very long time for habits to begin to die. We've also seen that in most cases, these corporations will want to absorb those taxes and they don't pass it on to the consumer. What we're saying, and that's why we're asking for that increase, is that it should be passed on to the consumer. Now, this is a very simple thing that people need to understand. There was a time that recharge card sellers were all over everywhere in Lagos. And then suddenly, somehow, we don't just need recharge cards anymore. And then what happened? People have to move to something else. There are actually so many people.
Yeah.
All right.
Well, I think that was a great question, actually, because then the people will feel like, at the end of the day, the economy is supposed to be stable, but at the end of the day, people are not getting to now buy the thing. They are not able. Okay, we have him back. Do we have you back?
Yes, we do.
What's
Mr. Akimbode, do we have you back?
Seen
okay.
globally as a trend. Yes, I can hear you.
Go ahead, sir. Go ahead, sir.
What globally we have seen is that, the national economy will continue to grow. That sector over the time may eventually begin to slow down, which is actually the desire of some of these taxes. But we gain that in health, and we gain more and more in other sectors of the economy that will absorb if there is any job loss. We've not seen job loss as a result of cut in tobacco. And there is no data to show that since being some taxes on alcohol in Nigeria, consumption of alcohol in Nigeria is actually going very, very high. There are beer parlors almost everywhere now in Lagos.
Mr. Akimbode, let me come to you here. We're talking about this. We're talking about sugar. Me as a person, I do not really take sugar because I know that it's not good for my health. Me as a person, I do not do that. But now let's talk about people that have the money to buy it. Because now we've been speaking about, the masses that would not really have the money. If they put tax, they increase it, they cannot buy it. What are the people that have the money to buy it? I feel like what we should do is that, I know with the tobacco, you see see that smokers are eligible to, you know, die early.
But they're still smoking.
But they are still smoking though. So this one, you know what to do with your life. You know, because let's talk about people that can afford it. There are people that can afford to drink the whole day. They have the money to do it. So even if you increase the tax to whatsoever, they will still do it.
So number one thing we should know is that the elites know what is good for them. You're an elite, and you know that sugar is not good for you. So that's why I said this is actually a pro-poor initiative. It shocks me when I happened to had breakfast with a minister almost 10 years ago, and you can't find any sugary drink in his house. And then, so the poor knows how to take care of their health and what they consume. Number two is that if they have any health challenges, they can also pay for their health challenges, including flying themselves outside Nigeria to go and seek better health. However, taxation is not only the tool. We're combining that with mass education. We are combining that with that there should be other regulations like front of pack labeling. So today, again, we've been talking to government agencies to put in place front of pack labeling so that Nigerians will know and they can decide, they will have enough knowledge about what they are buying and what they are consuming, and then they can take informed decision. We do not have enough warnings on products that are selling in Nigeria today. We are now talking to government to ban the promotion of these products to our children. You know, they're targeting our children. They are selling products that they themselves know are laced in sugar and are not good for infants and young children. They are actually using children models, which are actually illegal in other parts of the country. So we're looking at all these gamut of regulation to be able to protect our citizens.
All right, but let me just still follow up with you here. That you made a statement that the rich know how to take care of themselves. I'm sure that's what you meant by that. Don't you think that the most important thing to do is this education for the poor? Because from what you're saying, you know, this tax reform is for the poor. Because from what you're saying, once again, it looks like the poor don't know how to take care of themselves, if I'm taking from your words. So don't you think the education should even come in first? You spoke about labeling, which I agree to as well. Let it be there in the drinks that, okay, if you take this, this is what happens to you. I feel like people have the power to now choose what they want to do with their lives.
So essentially, there is also a long notion when the issue of choices are being overplayed by industry. You know, it's your choice to buy a car, but you don't have a choice to drive on the wrong side of the road. And for you to drive a car, you must actually go and get a license. That's why we have government. And it is the duty of government to protect us from ourselves. That's why you cannot, it's illegal for you to want to take your life. Now, however, what I'm saying is that the rich, actually, when people say this, they will say, oh, the rich will continue to buy. I'm just trying to tell you that a lot of them, you know, they know how to source for information. They have information. They are the best in the world. We're combining education. We're just trying to tell Nigerians that, look, this is not anti-poor. It's actually pro-poor. It's to help the poor people lead a healthy lifestyle. We're embarking on, you know, awareness campaign. We're doing a lot of digital media campaign. We go to communities, very rural communities in different parts of this country to be able to speak with our people so that they can be well informed to, as I said, lead healthy lifestyle and make informed choices as regard the kind of foods that they drink or what they smoke and the rest of that.
Okay, let us look at enforcing this thing because yes, it might be easy for manufactured sweet and compressed drinks, but we know this thing they call ice cream at bus stops, which is just coloring, sugar, and water that they tie in cellophane bags and they sell out for giveaway prices, and people patronize that thing so much. How is CAPPA putting together a mass education campaign that will try to discourage Nigerians from even patronizing that?
So first is to look at what was even defined as SSBs in the Fiscal Act. So it's very restrictive. I think somebody mentioned the fact that what happens to Zobo. People can take to Zobo. But see, once you lace your Zobo with sugar, it becomes an XXB. So the first thing we are also working on, part of what we're working on, is to expand the definition to capture all carbonated, sugar-laced drinks in whatever form. Either it is done in a multinational factory or in a Walmart shop or wherever, so that Nigerians can be well aware. Again, we are embarking on mass education. I also know that government agencies like NAFDAC are beginning to take this up. I know they're soon launching a campaign about Know Your Labels. The Federal Ministry of Health is working on that. But let me also say a trend that we need to notice, that citizens are beginning to be more aware of their health. I have seen a lot of citizens-driven digital media posts now that are beginning to ask questions about sugar level of what they take. They're beginning to look at the alcohol levels of what they drink. So the biggest thing is to have that movement, that citizen-driven consciousness for Nigerians to begin to ask questions, compare. There's a particular brand of cocoa drink in Nigeria, and then you have seen people compare it with sugar in those
yeah. Can you
in
hear
other
me?
parts of the world. Yeah, so I can hear you. So people are beginning to be conscious. They're beginning to look at what they drink and what they eat, which is where we think we can drive this campaign.
Absolutely. Very quickly, with this one coming up now, do you not feel that beverage companies might begin to kick, challenge the high taxes that the government is imposing on them, even though it's for the health of the people, and they will target unconstitutional and argue that it is right to trade, so much so that they will challenge the rates are violating investment treaties?
Thank you.
What legal argument do you think might begin to come up as a result of this very quickly?
Thanks so much. They are known to do that. Well, see, these are arguments that no longer holds water. Look, you have the right as a corporation to produce products. You don't have the right to produce product that kills people. It's globally acceptable, international treaties, that when the health of the people are concerned, your commercial rights comes under. It's duty of governments to first protect the health of these people, because only people makes a nation. If there is no nation, there won't be trade rights and the rest of them. So global treaties accept that health trumps commercial interests. And I believe that is what this government wants to stand for. For 2 years, we've heard those kind of rhetorics from the industry, but I think it's time that the Nigerian government stand very firm for public health, and stand firm for the people of this country and for sustainable health financing.
The alternatives are, let's say, watermelon juice and the tiger nut, like my colleague mentioned earlier, and a few of those things that can be done at home. But sir, you'd agree with me, these things are becoming neck-wrecking costly. If you go to the market now to buy a bowl of watermelon, or some cups of tiger nut to come make your own juice or date, and as the case may be, it costs past as it's been there before. So it's easier to fall back to a Pfizer drink, which is 800, 500 as the case may be.
Okay, so we just need to be a little bit more critical and ask questions. First thing is that the number one alternative is water. So drink water.
Okay.
Oh, really? So we should
Only
take food
water.
any longer. Only water.
Only water.
At least that
By the way, I was just playing around that because, just to let people understand.
You begin to, but again, then again, you begin to ask yourself, then again, part of what we are advocating is that when we have these taxes, we can also invest the taxes in promoting those healthy drinks that actually, will actually boost our local economies. So that's how this works.
All right. And, I don't know if you've heard about this, but there are some people that when they eat, they need to just take a frizzy drink when they eat. If not, they feel like they are not satisfied until they drink, you know, something that has a lot of sugar in it. So I feel like the mass education is something that we need to do. You know, we need to be heavy on. But when do you look at the implementation of this? How long are we looking at? 1 month, 2 months, next year? Just quickly, how long are we looking at this to be fully implemented?
Well, we expect our support for government on this, and we're going to be building civil society support for this, and I think there is huge mass support for this. Nigerians are beginning to differentiate between
okay, all right,
and those taxis that we expect government to find and deliver it to the Nigerian people.
All right. Thank you so much, Mr. Kimbode. Thank you so much. Great submissions from you. Thank you so much. He said something that really made a lot of sense. Know your label. Whatever you're buying, make sure that you check it, you read it before you drink it.